Good morning. It's Wednesday morning. It's the surgery day for Natalie. We have an interesting case today. Good morning. It's Wednesday morning. It's the surgery day for Natalie. We have an interesting case today. We're going to be doing a tummy tuck, liposuction, and fat transfer to the hips. Our wonderful patient lost more than 25 pounds and now she has some loose skin. So she wanted to look better and look how she should be after that weight loss. We're going to be doing tummy tuck, which is basically taking extra skin off of the stomach and pulling the rest of the skin down. We're also going to do a little bit of liposuction because we want to take that fat and put it in her hips. That allows us to make her hips wider and give her a more hourglass shape. Also, when we do tummy tuck, most times we sew the abdominal muscles together to bring the waist in and get her narrower waist. So that's what we'll do for her, and that will give her a really nice shape. So stay tuned.
I do feel excited. I worry a little bit, but I'm hoping for the best. I feel like I have a great team of people. I have a great team of professionals, so I'm in good hands. And I'm trying to be the best patient.
Surgery starts from that time because markings are very important because it tells me where to go, where not to go, how much to take from where. So we're going to do these markings. I'm going to mark the some of the anatomical areas of her body, what we call landmarks. And it'll show me where the folds are, where the extra skin is, where the extra fat is, where her muscles are. And that gives me a guideline, a blueprint of where to go, where not to go. Obviously, these aren't the incisions. These are landmarks. So this marks the midline. This marks where the edge of the muscles are. And these indicate the where we liposuction. The red here just indicates that indentation, the landmark. Again, we want to know where each part of the body is, where each landmark is. So we're done with markings. Now it's time for Natalia to go to the operating room. So we'll say see you later, and she's gonna go under anesthesia. I'm very particular about where I do my surgeries, the surgery center, and because I want it to be safe, well equipped, and I want the staff to be well educated and well equipped. I chose the surgery center because I really like the staff. I love the service and everyone is very well trained. The anesthesiologists are very safe and everyone knows my routine. They know what I'm doing. So that allows me to do my best during surgery. You'll be okay.
I'm going to give you some healthy juice.
You're in good hands. All right, Natalia is asleep. She went under anesthesia very easily, no complications. This is a very important part of the procedure. She is safe and doing well. Now we're ready to start the operation. Well, this is called scrubbing. We're scrubbing our hands from all kinds of bacteria. This is antiseptic solutions. You've probably seen this on TV. The first step of this surgery is melting the fat. We're going to use a baser, which uses ultrasound energy to melt the fat, and then it becomes like melted butter. And it makes the liposuction a lot easier and it makes the fat have a much higher quality. So I use this with all of my surgeries. The next step is fat harvest. We're going to suction out all that fat that we melted and we're going to save it in a canister. The fat that we get from the abdomen is really high quality, and that's the best fat that you want to use for fat transfer, especially in her case where we're transferring it to her hips. She's small, so she doesn't have a lot of fat.
Higher volume liposuction can be harmful, but not in her case.
You might have seen videos of people, going really hard, but you see I hold it with 2 fingers and I can get great fat. That's less trauma to the body, less trauma to the fat, and it helps the fat survive more when we transfer it.
A lot of people don't use Vaser because it adds another step, but you get much better results. It takes patience. You have to spend the time to do it. I spend the time to do that so I can get better results, I can get better fat. And it helps with the results being much smoother than traditional liposuction. This is an advanced technology that's helping us get better fat, better results. We did the liposuction, harvested that fat, and now it's safe in canister. We're gonna leave it until it's time for the fat transfer to her hips. The next step of the procedure is the tummy tuck. First, I'm gonna do more markings, and this is very important. I take my time to make sure the markings are very straight, and I measure twice, 3 times, because for me, the placement of the incision is very important. I want my patients to be able to hide the incision under a 2-piece bikini. So I take my time in this part of the procedure. Now it's time to make the incision. This is the most important cut. It will determine how good her incision and scar is going to be. After I make the cut with a knife, then the rest of it, we're going to use an electric knife, which is called a bovie or electrocautery. It stops the bleeding as well. So it makes our job a lot easier. It makes the surgery a lot safer, a lot better. When we use bovie to cut through the tissue, it heats it up and it cauterizes the blood vessels. It burns the blood vessels and it stops them from bleeding. So it does 2 jobs at once, cut and burn. Now we've sewn her muscles back together, and you can already see how snatched the waist is. It brings that waistline together. And I think that was one of the main reasons why all that exercise couldn't give her flat and snatched. I sewed the muscles together. Now it's time to trim all that extra skin. This is what all that extra skin looks like. Skin comes from when she gained weight and her skin stretched. When she lost that weight, the skin didn't shrink back together. So now we were able to cut it out surgically. When you're young, if you gain weight and you lose weight, that skin shrinks better. But as you get older, it gets a lot harder for your skin to shrink when you lose weight. So a lot of patients say, I've been working out so much, I lost all this weight, but I just don't feel flat. That's because the skin cannot shrink on its own as you age. But most of the time, as you get in your 30s, the skin loses that elasticity. It doesn't shrink anymore. The next part is suturing the skin, closing it. We do it multiple layers. We do it deep, we do it superficial, because we want that closure to be really tight so it doesn't open and also the scar doesn't get white. It needs to line up very well in order to get that really fine scar. So I'm gonna take my time to do this part of the procedure. Next, we're gonna put these drains. We're gonna put these tubes under the skin, and they're gonna allow fluid to drain out and not build up under the skin. A common question is, what happens to the belly button during a tummy tuck? So here's what we do with it. First, we leave it where it's attached to your stomach. We pull all that skin down, and then you got a flat, smooth stomach, and we make a little hole and pull that belly button through that hole and deliver it. But also, we're gonna redesign it. We're gonna trim it, we're gonna make it smaller. She asked for a smaller belly button. So I trimmed it, I redesigned it. So you're gonna see her new belly button. Remember all that fat that we harvested? It's been sitting waiting for us. Now we're gonna transfer it to her hips as much as her hips allow. We were able to fit about 170 cc's of fat in each hip, and that's a lot for those little hips. That will give her a really nice shape, a wide hip, narrow waist. She'll really like it. And for the final touch, we're gonna put the dressing. They're called stereo strips. They cover the incision so it stays clean, no bacteria go in there, and also it just looks nicer for the patient. Time to get my after photos. I always like to take photos on the table. They look good, and also it shows me how they looked and how they progress. So we'll see how her progress is going to be, what she's going to look like tomorrow, a few days from now. I'm so happy for her. She's going to have a really good result. Time to rehydrate, feed myself, and once she comes to recovery, we're going to talk to her, and as she's waking up, you'll see her. So it's been about half an hour since she came out of the operating room, so she should be a little bit more awake now. So let's go see her.
Hello, hello, Natalie. How are you? You did so well. How are you feeling? You look flat. Yeah, you want to see the pictures now?
Was a good patient.
Yes, you were. You were very good. All right. Look. Right awake. She's speaking in English. She's counting to 10, and she actually did very well with anesthesia. Now Natalia is going to be in the care of our wonderful nurse who's going to take care of her, watch her as her blood pressure gets stable, as she's waking up even more, and make sure everything is going to be okay, and then discharge her home. Thanks everyone for watching this whole process. I really appreciate you taking the time. I want you to ask us questions, give us feedback. I read all of them and I'm going to respond to you guys. I know a lot of you may have different questions about the process, about the procedures. Just send them to us. We'll answer all of them. Thank you for watching. Follow us on Instagram and YouTube. We're going to keep you updated. We have a lot more to go.